Hey everybody, thanks for tuning in again to Brent and Friends Nonsense and Trends, episode number 2 of our Medicare Basics breakdown, our 4-part episode where we discuss all the different types of kind of Medicare plan options that are around. Last week we talked about original Medicare A, B, and we talked a little bit about D. Today is Medicare Part C, right? Medicare Advantage Plans. We're going to be talking about those quite a bit here with my partner Plemons. What's up, Jim?
It's good to be back.
Good to be here, buddy. Thanks, man. See you guys there. Hey everybody, thanks for tuning in to Brent and Friends Nonsense and Trends. We are back with my partner, Plemons.
Oh boy. Man, you laid it down today.
We've had so much fun with your name though, buddy.
Yeah.
Dude,
yeah. It's a unique name.
What was it that I called you one time at a seminar in front of a bunch of people?
Dr. Plemons.
There was that one. There was one that was funnier. One that was really funny. Smoking Jim.
Smoking Jim.
Smoking Jim.
Smoking Jim Plemons. That was the full name. Was Smoking Jim Plemons.
For those of you who don't understand our relationship yet.
Oh boy.
Jim has one of those names that I just have so much fun with. And I can't ever...
Well, one day I spelt it for you and I said, it's lemons with a P.
With a P.
And it just like the light bulb comes on when I tell people that. They're like, oh, lemons with a P.
A few years ago,
That's
we
so
had just
easy.
met. Yeah. And so now your P, it's either P lemons, it's P freaking lemons sometimes when I'm super pumped on something.
Yeah.
P freaking lemons.
Yeah, you're excited when you say
I'm
that.
super jacked when I see you, or Smoking Jim Plemons.
Smoking Jim.
Smoking Jim. I think you're
for short.
Johnny Boy, your son loves that.
He
thinks
does.
It's hilarious,
he does.
right? I've changed.
It's
It's changed the face of our interactions. I think other people have even picked it up. We're totally rabbit holing right now. Today we're supposed to be talking about Medicare Advantage plans. Right. Medicare
Back on track.
Back on track. Medicare Part C. Medicare Advantage plans. What the heck is a Medicare Advantage plan? So basically, a Medicare Advantage plan, the simplest way I can put it, folks, is a Medicare Advantage plan is when you allow a private insurance company, for example, like United Healthcare, Humana, Blue Cross Blue Shield, Cigna, whoever,
right.
Just to name a couple of the big ones, right, that are pretty much national. Blue Cross Blue Shield, Anthem, whatever. It's when you allow a private insurance company to essentially manage
your Medicare benefits.
Part A and B.
Yeah.
Right? It doesn't always include D.
Most of them
do, but it doesn't always include D. Mm-hmm. So you know what?
It doesn't have to have D to be a Part C.
It does not have to have D to be a Part C. That's actually a really good spot to start, where we go over the difference between a plan that is MA only and MAPD.
Correct.
Right? So MA only means Medicare Advantage only, and that might confuse people who are listening right now. We'll go into that in just a minute, and then, but it rounds off when I tell you what MAPD means. So right. MA only is Medicare Advantage only. MAPD stands for Medicare Advantage plus prescription drug.
PD.
Yep. So it's easy enough to know that MA only means Medicare Advantage with no prescription drugs.
Right. It's taking those Medicare Part A and B benefits and it's managing those benefits for you on behalf of Medicare Advantage only.
With a prescription,
if you're in a MAPD, you're taking those D drug benefits and putting them in there too.
And it's all through a private insurance company,
right? Yep.
Right?
That's right.
So in our previous episode when we were talking about just like the basics of original Medicare and Medicare fee for service, et cetera, we were talking about Part A and Part B of Medicare. Then we talked about D like drugs, and we talked about how D like drugs is separate. It's all through a private insurance company, blah, 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 boring stuff, right?
Yeah.
But really good for you guys to understand that Part D is always through a private insurance company, because if you don't go to a private insurance company, you don't get your Part D, which this is actually something we didn't even touch on our last episode. Shame on us. Right. Is that if you don't go get your Part D through another source, not regular Medicare, because they're not going to give it to you, right? You got to get it through another source. You got to qualify, be eligible. You got to go get it somewhere. You'll be penalized if you don't.
Right.
So But again, in the same way that Medicare Part D like dog or D like drugs, in the same way that it's not on the original Medicare platform, you got to get it through a private company. You can also say, well, what if I wanted my Part A and B to also be through a private company? Like with D, you don't have a choice.
Right.
It's always
all they cover is drugs on a Part D.
And it's always hosted elsewhere, right? It's not ever hosted on Medicare's platform.
That's right.
Your retail drug benefits, at the pharmacy, it's never hosted on just regular Medicare's platform. You got to get it somewhere else.
Right.
Now, with regular Medicare for A and B, you have the choice. You can have it with regular Medicare, or you could take your A and B and you can get it elsewhere, like you would with a drug plan, right? That's where things kind of start to get really confusing. So when you see Medicare Part C, and then you see Medicare Advantage, they are synonymous.
Right.
They're the same exact thing. There is no difference between Medicare Part C and Medicare Advantage. There's just different parts of, like, Medicare Part A is hospital, Medicare Part B, or A is inpatient hospitalization, etc.
Stay in the night.
B is outpatient medical. C is Advantage. D is drugs.
Right.
So definition of D is drugs, definition of C is Advantage, definition of B is medical, definition of A is hospitalization and inpatient care.
That's
so
right.
It's, the reason why Advantage and C are synonymous is because C is basically the label, the name, Advantage is the definition.
Right.
As if that's not confusing enough.
Well, Medicare, they had to give it a part name so it would match up with the rest.
They had to give it a part name, and they had to make everything super duper confusing too.
Right. Give it multiple names.
And give it multiple names, right?
Yeah.
So
that way they call us for help.
That way they call us for help, because God knows when you dial 1-800-Medicare, have fun sitting on hold for. Medicare's actually gotten a little bit better.
Hold on, let me put you on ignore for a minute. Turns into 30.
Well, and then a lot of times you get a hold of a level 1 representative who doesn't really know what they're doing, and that's a shame. No offense to them. So with Medicare Part C or Medicare Advantage plans, it's typically going to be Part A and B of Medicare, and a lot of times D of Medicare, all hosted on one platform,
right,
with a private insurance company. So here's how I talk about it in my seminars, or in our seminars, excuse me. So here's the way I discuss it is, when you get those advertisements and those flyers in the mail, and they say 0 premium on a monthly basis, 0 copay at the primary doctor, 0 copay for generic prescription drugs,
free membership,
free gym membership, and free over the counter products. And if it's not 0, it's free. And if it's not free, it's 0. Right. And then I'll look at the crowd and I'll say, hey, who's gotten some of those advertisements in the mail? And they all raise
everybody's
their
hand goes up.
And then I go,
who believes it?
And who thinks those things are just absolute a total joke? Like, who's not buying it? Raise your hand if you're not buying it.
There's no such thing as a free lunch.
There's no such thing as a, what's so funny is at our seminars where we're giving away a free dinner, I'll go, and there's no such thing as a free dinner. And then everyone starts laughing because they're here for the free dinner. They're there for a free dinner. So, but there's no such thing as a free lunch. And then we explain to people, well, here's the deal. You have to, if you are on Medicare, a lot of times you're paying a premium on a monthly basis for Medicare Part B, like boy. Part B a lot of times costs a premium. Now, there are some people who don't have a premium because maybe they're getting subsidies from the government, state government, whatever it might be. A lot of people don't have to pay that premium. But most people do.
Most people.
And so that premium, we're not going to get into what the premium is, because the premium is going to be subjected to whatever your income bracket is. So it fluctuates.
Right.
Now, here in 2020, the average Joe, the average person, they pay $144.60. That might go up next year. So if it's 2021 and you're watching this, take that with a grain of salt. That might not be what the premium is anymore. Now here in 2020, it's $144.60 for the average Joe, but we're not going to go into who the average Joe is, what the income qualifications are.
Just know that if your income is significant, you're probably going to pay a little more.
And the good thing is that significant to Medicare might not be significant to you. So again, talk to your accountant, your CPA. It's easy to find online. You can find a chart if you just search it like on Bing or something like that. You can find that chart. Whatever, it's no big deal. So, but you have to pay that Medicare premium. So everybody thinks, how can these Medicare Advantage plans give you all these benefits for free? Well, they're not exactly free. The plan a lot of times just comes with a $0 additional premium.
So when they say there's no such thing as a free lunch, they're actually correct. Because it's not free.
It's not free.
Somebody's paying for it.
It's being paid for. And in a way, it's actually being paid for by you. But it's not one of those like, pay no attention to the man behind the curtains, funny business. It's not that. It's because you're paying your Part B premium of $144.60 or whatever it might be. That premium, the majority of that premium doesn't stay with Medicare. So if you want your Medicare Part A benefits, your B benefits, and your D at some points, if you want those to go over to a private insurance company and then you get a Part C Advantage plan, the majority of that $144.60, not all of it, and we're not going to get into that, but the majority of that $144.60 actually gets sent over to the Advantage plan, and they're capturing that.
So they redirect those funds to the private insurance company who's actually managing your benefits.
Right, because Medicare is not managing your care anymore.
Right.
Medicare is not paying any of the bills anymore. The Advantage plan is. And so why would someone go on to an Advantage plan instead of original Medicare? Because a lot of times this Advantage plan is going to give you certain enticements. Like what we talked about last time, how there's no cap on original Medicare. And these Advantage plans,
they put a maximum out of pocket on there, right? There's a nice little cap.
There's a nice little maximum out of pocket on there.
$3-4 grand sometimes.
Sometimes $3 or $4 grand. There are plans right now here in where we're at in Maricopa County. There are plans out there that have maximum out of pocket caps of like $3,200.
Right.
There are some that are even a couple of bucks lower than that. And they're kind of like the exception, not the rule. Normally we're looking at like around
six.
Well, some of them are high, like 6. Some of them are lower, like 2,900, which is crazy, blows my mind. But the norm is like anywhere between 3,000 and 4,000. Right.
In Maricopa County.
Right. And so in that event, you have a catastrophic year, you get diagnosed with kidney failure, you're racking up 20 grand in medical bills. At that point, you're not going to be out of pocket an absorbent amount of money, right? You'll absorb no more than
once you hit that 2,900, 3,200, whatever it is, you're covered.
And that's but that's the portion you pay, right?
Right.
It's the portion you pay. So if you, with this Medicare Advantage plan, some of the perks of going on to these Medicare Advantage plans is because they're telling you, hey, yes, our plan might be an HMO. We're not fee for service like original Medicare. Like we have a claims department that reviews every claim.
Right.
So, these Advantage plans, for those of you who might be freaking out, they're not just denying claims left and right. They're really not.
Yeah.
So don't worry about that. But a lot of them require referrals. We're actually going to be doing an episode here in the next few weeks called No Referrals Required. Right. That's going to be really fun.
And the doctors know too. They got a pretty good idea of what they know is going to get approved. I mean, they're not sending you out for tests and, for doctor's visits that are going to get denied.
They understand the system in which
they got to play by the rules and they know how to get paid.
So the perk would be, maybe you have to get a referral. Maybe you have to get an authorization here and there. Maybe it takes you a couple of days to get something done versus a day. Right. Mm-hmm. But they're giving you that safety net of an out-of-pocket cap. They have to, matter of fact. They're not allowed to have a cap. And in Arizona, or actually it's in the United States, I think it's a national rule that the highest a cap, and don't quote me on this, at least in Arizona, the highest the cap on a Medicare Advantage HMO is allowed to be is $6,700.
Right. I think that's it. Yep.
So I think that's going up next year.
Yeah, so those fluctuate every year too. They go up and down and adjust.
Yeah, and there are rules, and we can't necessarily speak too much on that due to the time of year that it is right now. We can go into that a little bit more at a later time because certain information gets released to us a little bit earlier than it does the general public.
Right.
But we're not really allowed to publicize that information just yet. But the cap right now in Arizona for an HMO is $6,700.
Right.
So basically that's the highest. Now an insurance company can give you a cap that's lower than that, but they can't give you, they can't give you one that's higher than that on in-network services on an HMO. They're just not allowed to. So if you're, as I like to say, let's say your head falls off 5 times, right? And you're going in and out of the doctor in the hospital and you just keep getting your head sewn back on. It's costing you, a ton of money each and every time. Your worst case scenario is going to be $6,700. That's most you're going to be out of pocket. You're not going to, and so,
that's a lot of money, but it's a lot better knowing you have a cap on your spending versus the uncapped original Medicare.
Well, yeah.
Where there's no top. They can just keep 67 could be just the beginning.
Well, I had a client in Flagstaff. He actually sent me a text message. I don't even know if I can pull that text message up. I had a client in Flagstaff called me just last week, and he had said, he called me to thank me for putting him on a Medicare Advantage plan, which I was actually really shocked, but he had said that he landed in the hospital. He had major heart issues. He had 2 different surgeries, and he said that the final bill was like $178,000.
Wow.
And he goes, Brent, I just want to thank you. I'm out of pocket $800.
$800.
You know, I've sat down with people who have said, you know, oh my gosh, if I go to the hospital, it's going to cost me $800. I don't have $800. And don't get me wrong, like I sympathize.
Right.
I really, really do.
$800 is a lot of money. But it's not compared to $178,000.
To some people, $800 is a fortune.
Right.
Right?
Yeah.
But this guy landed in the hospital. His medical bills were $178,000. He called me almost in tears because he thought he was going to be like selling his truck and stuff.
Yeah.
And his costs out of pocket were $800. That is life-saving, life-changing. Yeah. And so that's what these Medicare Advantage plans are essentially going to do for you. They're going to provide you those caps and those safety nets and those features. There's a trade-off sometimes though, right?
Yeah. In most cases, it's the best insurance plan they've ever been on. They don't make them like Medicare Advantage plans for people that are under 65. They just don't.
I find myself frequently telling people when they say, Brent, you know, really, what do you think about Medicare? Because I think, okay, so as we hit the timeout button on this for a second, there's so many opinions out there online on the internet about Medicare Advantage plans and why they suck. And, you know, we did a podcast on that, right?
Because they're in an HMO. And
right.
Yeah.
So a lot of times you get these insurance professionals and they talk about why Medicare supplements are so much better than Medicare Advantage plans. But the reality is this, you know, you got to weigh the differences, which we're going to do in 2 episodes from now. We'll weigh the differences between Advantage plans and supplement plans. We'll talk about it for a second, but you got a lot of professionals that just like to hate on Medicare Advantage plans. And I look at Medicare Advantage plans and I think to myself, I have never in my life had an insurance plan that good.
Never.
I've never had one that good. And listen, I've got pretty darn good insurance right now.
In most cases, they have a $0 premium, additional premium.
Right, additional premium, additional to Medicare Part B, which is $144.60. So here's the thing. My family, and I'm not going to get too deep into this, but my family, we're paying about $550 a month for our insurance for our whole family. That's really not that bad considering the huge clan we have. Right. I got a big family. We're paying about $550 a month. It's not terrible. My son landed in the hospital in February, remember, right? He broke his femur. Right? He had major surgery, my 6-year-old boy. Major surgery. The medical bills were like $78,000. They were huge. They were pretty big. They're not $170,000 like my client in Flagstaff. But the medical bills were like $78,000 and our out-of-pocket is like $4,000. And we're sitting here thinking, thank God we have good insurance. Right? Because being out of pocket $4,000 is not bad compared to $78,000.
It's not going to change your way of life.
No, it's not going to bury
your life. Yeah,
it's not going to bury us. And in reality, we know that if we called the insurance company and we said, look, the bill, or if we called the medical providers and we said, look, these bills were $78,000, we're out of pocket $4,000. So we know that the medical providers have all received pretty darn close to $73,000, right?
Yeah.
Can you guys wait a little while for the other $4,000? Can you make arrangements with us? We know they will. Yeah. So the point is this, we're thanking God that we've got a plan that left us out of pocket $4,000 when we had that big of an experience.
Sure. I
just had a client in Flagstaff had $178,000 worth of medical bills and he's out of pocket $800.
That's phenomenal.
I mean, look, they're actually not bad plans. They're pretty good in reality. So I don't hate on them. I think they're great. And actually, I think we kind of ran the numbers. I think like 70% of our clients are on Advantage plans right now.
I think so.
We got a number of clients on.
And about half of those people are for 2 different reasons, right? It's either because they don't want to afford the premiums of a supplement plan or because they can't.
Well, there's a third reason. They either A, can't afford the premiums on a supplement plan, B, don't want to afford the premiums on a supplement plan, or C, maybe they can afford the premiums, but they medically can't qualify. We'll cover that one in our next episode though, right? We'll cover that. So Medicare Advantage plans, I have to be very candid the way I speak on this right now. In 2020, there's only one thing that medically will stop you from getting a Medicare Advantage plan. End-stage renal disease.
End-stage renal, yep.
Okay, so...
It's the one kick-out question, one disqualifier.
Hear what I'm saying. In 2020, there's only one thing that will stop you, and that's end-stage renal disease, kidney failure. In 2020, there's only one thing.
Right.
Okay. So hear me without me saying it, right? Just know that there is change coming. So this year, they're not medically underwritten. Anybody can get a Medicare Advantage plan as long as you don't have kidney failure.
Right.
Okay. Let's hope and pray that changes sometime soon.
Yeah. Wink.
Wink. So we'll go over that maybe next year or at a later time, closer towards the end of the year when some changes have been announced on that. So you don't have to have many medical or you don't have to qualify based on a medical exam to get an Advantage plan. It provides you caps and limitations on what you can be out of pocket. But a lot of times it might come with its own set of limitations on the way you can get care provided to you or where you can go, right? Like it might be a restricted network like an HMO.
Yep. Most of them are HMOs. There are PPOs as well.
There are PPOs as well, which are actually, PPOs are like making a comeback, dude.
Yeah, yeah. And the HMOs aren't as bad as they used to be.
No.
We just did an episode on that too.
We just did an episode on that, why HMOs suck. Please go watch it because guess what? Here's a little secret. HMOs don't suck.
Yeah.
It's a lot of times our perception versus
reality.
reality.
It's not the 80s anymore.
It's not the 80s anymore. Perception versus reality. HMOs are not for everyone. However, we're going to be doing another episode here pretty soon called No Referrals Required that you folks can stay tuned to, where we're actually be talking about how most Medicare Advantage plans, I think this next year in 2021 in Maricopa County, there's going to be just as many HMOs that don't require referrals as there are HMOs that do.
Wow. And that was one of the biggest drawbacks of these plans. People, they just don't like the network. They don't like waiting on a referral.
They had to adapt.
Yeah.
Right?
Which, most under 65 plans have that same requirement. If you're on an HMO and you're not 65, it's not a Medicare plan. You still have to go to your primary care doctor and get a referral.
Right.
So it's not like it's a new concept when you get on Medicare.
But people want the freedom when they go on to Medicare. They want to be free.
Because they have friends that have supplement plans who don't need referrals.
And I've been on, in the last several years, just due to my spouse and being married, I've been on group plans. Right. And all the group plans I've been on have been open access, like HMO POSs. Right. So what that means is no referrals required. Yeah. Right. So what I'm saying is, moving forward, folks, for those of you who are listening, the moving forward trend. Okay, so our show, Brent and Friends, Nonsense and Trends, we're going to be talking about an ongoing future trend. Right. Of Medicare Advantage plans that are HMOs no longer requiring referrals. Okay. Yeah. There happens to be an HMO in Arizona that also, as long as the bill is under a certain dollar amount, they're not even asking for requirements on procedures and tests, as long as a bill is below a certain amount. So these Medicare Advantage plans are starting to remove some of these barriers that restrict people from getting care quickly. Yeah. Right. And so just understand that these things are changing. So Medicare Advantage plans is when you allow a private insurance company to manage your Medicare A and B benefits, and a lot of times D. Right. And so you can walk into a doctor's office and instead of showing your red, white, and blue Medicare card and then going to the pharmacy and showing your Medicare Part D prescription drug card, instead you can have one card where you go into the doctor and you show them one card through Blue Cross Blue Shield. And then you go to the hospital and you show that same Blue Cross Blue Shield card. Right. Then you go to the pharmacy and you show that same Blue Cross Blue Shield card, because everything is all balled up into one managed care plan. One plan through one private insurance company. It might be Blue Cross Blue Shield or Bright Health. And who the heck's Bright Health anyways? Yeah. Right. It's one of my favorite jokes. Right. Who's Bright Health?
We'll have to have an episode about who Bright Health is.
Who's Bright Health? We actually, my first episode, we actually talked a little bit about Bright Health with David Weston. Bright Health is an absolutely awesome plan. Yeah. And so they're a new up and coming plan. They're still considered relatively new, but so they're one of the plans that's actually trying to provide people access to quality and convenient, timely, quality, convenient healthcare. Right. So they're trying to get them access to care quickly. It needs to be good and quality care. And a lot of the plans are really going in that direction.
In order to have a Medicare, now back on this Part C, in order to have a Medicare Part C, you have to enroll in Part B. You have to have A and B to get Part C.
That is correct. So you have to have Part A and B, because the Medicare Advantage plans are designed to inclusively cover not only inpatient services, which is Part A, but outpatient services, which is Part B. In order
if you don't enroll in Part B, you can't get one of these managed plans.
Because there's no funding for the Part B side, right? So the funding, again, comes from you paying that Medicare Part B premium. If you're not paying that Part B premium, then Medicare isn't receiving that money and isn't able to send it over to your Advantage plan.
Right.
And if your Advantage plan isn't getting that funding, you're not eligible for the plan.
Right. There's also a lot of funding for the Part A that gets redirected towards them as well, too.
Holy smokes.
Because even $144, honestly, that's not enough money per patient to cover all the benefits they provide in an Advantage plan.
Dude, let's talk about this for a second, because if I was to be in a crowded room and I was to say, raise your hand if you think $144.60 a month is enough to give you that plan that costs you $800 when you go to the hospital and the bill's
no way.
$170. It's not enough, right?
Not even close.
So it's not even close. So, these plans get funding from Medicare on a monthly basis for Part A as well. And a lot of times that funding, guys, can be anywhere between $700 a month and $1,200, $1,300, $1,400 a month, just depending on your health, depending on what type of benefits you're eligible for. Some people get extra help from the government because they're very low income or because they're disabled.
Right.
So
like on average, you enroll in a Medicare Part C Advantage plan, that Medicare is on average redirecting almost $1,500 a month on your behalf to that Medicare.
If you've got diabetes and you're sick, or you've got some health conditions, they're dumping more money into the plan. And if you're very, very healthy, they might not be putting as much into it. But yeah, you're right. It could be upwards to $1,500 a month getting dumped into these plans. So
now if I asked you, is $1,500 a month worth it for one of these plans? Do you think that's getting enough money?
Extremely worth it. I would actually venture, I think we say
per
this,
patient.
We say this in our seminar. I'll say, hey, look, if these plans are getting $1,200, $1,300, $1,400, $1,500 a month for you and you and you and you and you and you and you, don't you think they better be giving you some zeros?
Better give me a free gym membership.
They better be slapping some dental in there. It's common, but people don't, I was going to say it's common sense, but it's not, because people don't know this.
They don't realize where that money comes from. They just think there's no way this can be free, and this something. Where's the catch? They're looking for the catch. Well, that's the catch.
That is the catch. They don't understand that. And where is Medicare getting all that money? Well, you paid into Medicare Part A for years and years and years while you were retired, while you were working towards your retirement. I like to tell people, remember when you get your pay, when you're working and you were the working class, right? And you got your paycheck,
Medicare tax,
and you looked at your paycheck, and this overwhelming sense of joy came over your body. You were so excited to see that they took money out of your check for taxes.
Yeah.
Woohoo!
Yeah. Right? I actually saw somebody posted a video online. It was this kid got his first paycheck, 16 years old. He was so excited for that first paycheck. He opened it up and it was like letting air out of the balloon. He was just like,
what is this money?
A third of his check was gone in taxes.
Oh, man.
And his dad was just like laughing at him. Like, welcome to the world of income tax.
Welcome to America. So you're paying, when you were paying money into taxes, you're paying into Social Security, you're paying into Medicare. So you've dumped money into Medicare Part A in advance, which is why when you go on to Medicare, when you turn 65, in the event that you've worked your 40 quarters, which again, it's not what this episode's about. We're not talking about qualifications of Medicare, but you do need to work a certain amount of quarters. You do need to qualify, full-time worker for a certain amount of time. 40 quarters and paying into Medicare typically takes about 10 years or more in order for you to work enough in the workforce at full time in order to be eligible for Medicare and Social Security and disability. So when you've paid into that system long enough and you've met those prerequisites, Medicare Part A is not... It's not free. It just
You've just already paid for it.
You've just already paid for it. You paid for it in advance. It's like having a truck that's paid off.
Right.
Yeah, and there's still some costs associated with that truck when it breaks down. You got to pay to get it fixed, but you own it outright. And so Part A, you own it outright now, basically. And there might be some costs associated with it when you go to the hospital. Part B, like, boy, you didn't pay in advance. You don't own it outright. You got to finance that sucker. So you got to pay for it as you go. And so that's where these Medicare Advantage plans, that's why they're able to get all of those fundings from Medicare for Part A and Part B, because Part B you're paying into, Part A you already did pay into. And so Medicare is pooling together funds and distributing it over to the Advantage plan. And one more thing I want to just address, because I'm tired of hearing this. You go to these doctors' offices. I have clients who will say to me, hey, Brent, this Medicare Advantage plan, it looks pretty good, but I really want to talk to my doctor and see what they have to say about Medicare Advantage plans. And I'm like, ugh. I love that people want to depend on their doctors, but here's the thing. I don't know if there's ever been a client that's gone to their doctor and said, hey doc, I really appreciate you wanting to help me with my diabetes, but I really want to ask my insurance agent if I should do this.
Right.
Right. Like that would be really,
they want to ask their doctor if this is a good insurance plan.
Right. Why would you want to ask your doctor if this is a good insurance plan? You think that your doctors are going to know what's a good insurance plan and what's not. Typically your doctors know what insurance plans pay them faster.
Yeah.
You might want to consider that a little bit, but you should not let that be the determining factor in what plan is ultimately going to provide you the best care. Yes, your doctor is important. Your doctor deserves to be paid. But most of the time, I had one client call me last week where they said, I talked to my doctor and my doctor really wanted me to go with insurance plan.
Right.
Okay. And I said, why is that? And she said, well, I have a brace that I really need to get. And it's a mechanical brace and it connects to the electrical currents in your brain. And when my brain tells my right hand to move, the brace moves. It's really great. The brace costs like $250,000, right? And so she said, my doctor told me to go with this specific insurance company, XYZ insurance company, because
they pay a benefit for that.
This doctor says they've dealt with multiple people on Medicare and that insurance company has approved the brace faster and more often than any of the other insurance companies. So I said, that's really good advice from your doctor. Is that doctor has seen the results on the patient side with that insurance company more often. I'll accept that.
Yeah.
But most doctors will say, no, don't go with that insurance company because they take 3 weeks to pay us. And that insurance company pays us in a week. Well, I frankly don't care how fast an insurance company pays the doctor. I care how fast the insurance company provides care to my client.
Right.
Right. That's really what the client should focus on, in my personal opinion. And so, but these clients, they'll go to these doctors and they'll talk to them about these plans. And most of the time, the doctors, they know what insurance plans are going to pay for what. They know how they're going to behave. And so, I mean, I don't even know. How did we even get on this topic? What did you say that got me going off on this rabbit hole?
I forgot.
I
lost track.
Gosh dang it. I should have been taking notes here. Anyways, it's
easy. It's easy to get distracted talking about Medicare. There's so many things, so many details that, I mean, we could talk for hours.
It's not often I get going down a rabbit hole.
Yeah, never. That's why our seminars that are billed at 30 minutes take 50 or 60 minutes to get through.
I'm a talker, dude. Anyways, so with that being said, those are kind of the premises and the breakdowns of Medicare Part C plans, Advantage plans. Part C and Advantage are pretty synonymous. They essentially are the same thing. And it is a private insurance company that manages your Medicare A and B benefits. So essentially the benefits are outsourced. Right. You're not losing Medicare. I know why I brought that up, because there are so many people who will call their doctor and say, what do you think of this Advantage plan? And the doctor's office will say, if you sign up for that plan, you're losing Medicare. You're giving up Medicare. No. That's why I was going to bring that up. See, I remember.
Yeah, and you don't give up Medicare.
And you're not giving up Medicare. When you sign up for an Advantage plan, you are not giving up Medicare. You're not losing Medicare. You're not forfeiting Medicare. You're not disenrolling in Medicare.
They're temporarily assigning the management of your benefits to a private insurance company.
About 15 years ago, when we were selling Medicare Advantage plans, there used to be insurance agents that would enroll someone in a Medicare Advantage plan, and they would take a sticker for that Medicare Advantage plan, and they would grab that person's red, white, and blue paper Medicare card, and they'd take a sticker and they'd put that sticker across the front of their red, white, and blue Medicare card, saying what Advantage plan that they've enrolled in, and they would deface their Medicare Advantage plan. And there were people who would even tell clients, you're not on Medicare anymore, destroy your red, white, and blue Medicare card, or they'd put a sticker on it. And the problem is that if they ever disenrolled from that plan and they went to tear that sticker off their paper card, it would ruin their card.
Yeah.
Medicare actually made it illegal for them to do that. And I used to hate it because I'd show up at people's homes and I'd be like, hey, you want to switch to this Medicare Advantage plan. I need to see your red, white, and blue Medicare card so I could see the information on the front. There's a stupid sticker on it.
Yeah.
And I'd go to pull the sticker off and it'd ruin their Medicare card. I'm like, well, great. Well, now I can't see what your ID number is on your Medicare card because it's ruined. Yeah. Because some goof put a sticker on it when he shouldn't have. And so
you made a good comparison the other day about Advantage plans, and the comparison you made was like when you buy an extended warranty on something, right? Mm-hmm. Remember you said you go into the store, you buy a piece of electronics, you buy extended warranty, but then it breaks. Mm-hmm. you say you bought it from Best Buy. Well, Best Buy doesn't show up at your door to fix your TV.
No.
It's, John Doe's electronic services shows up to fix
Right.
So they've basically, you've bought an extended warranty through Best Buy.
And it's being outsourced.
And they outsourced the management of that care to a third party.
Of that service, right.
Right.
Yeah, and your Advantage plan is the same.
Right.
So Medicare, you're purchasing the Advantage plan. The Advantage plan is being purchased and funded through Medicare's system, but all the services and support is being outsourced over to the private insurance company that you chose.
Right.
Simple as that.
Yeah.
I mean, we can cut it right there, man. I mean, that's pretty much it. So for those of you who are needing more information on that, www.theturning65advisor.com. You can go to our website, click on Medicare, drop down. There's Medicare Basics, Medicare Advantage, and Medicare Supplements.
It's all there for you.
And it's all right there for you. Stay tuned for our next episode, guys, where we'll be talking about Medicare supplement plans. See you next time.